You're listening to Parents You've Got This, the expert guide to parenthood, the complete guide to fertility, pregnancy, birth, baby and parenthood. This podcast is proudly supported by Mistela, a natural origin skincare for babies and children, recommended by healthcare professionals. Mistela by Parents' Side since 1950.
Today on the Expert Guide to Parenthood podcast, we're going to be talking all about worms with our paediatrician expert, Dr. Lexi Frydenberg. We're going to be talking about how your children may contract them, what to do if they do get them, and how to get rid of them.
Dr. Lexi Frydenberg is an experienced general paediatrician working with little ones from when they're newborns to 18 years old and also their families. She works in public and private practice and does lots of media, so you may well recognise her. She really is the best in the business. Lexi, thank you so much for being with us today.
Thanks for having me.
Now, this is one of those topics that we've just got to cover because it is a part of being a parent. Let's talk about the different types of worms. What are they?
Yeah, so worms, when we're talking about worms in kids, it's the worms that are in the intestine, so in the gut of kids that come out their bottoms. And usually it's a threadworm, or otherwise known as pinworm, and it's a type of roundworm. And that's the most common type of worm in Australia that we talk about. It's really, really common in preschool children and school-age children. Unfortunately, you can actually also get them as adults, but it's much less common. But the good news about worms is they're usually not serious. Your child won't be unwell. They're annoying, but you can get rid of them in most cases pretty easily. Phew.
So what are the signs that your child might have worms?
So the most common sign is you'll see your child having an itchy bottom and scratching, usually at night. And you might notice their bottom might become red and a bit inflamed from all the scratching. They might have a really disturbed night's sleep and be really irritable. Their appetite might be down. And in girls, you might actually see redness around the vulva and vaginal area. And that happens because the worms that crawl out of the bottom can go into the vulva and vaginal area and cause some inflammation, what's called vulvovaginitis. So itchy bottom is definitely the most common thing we see in kids with worms.
How do you check your child for worms, Lexi, if you suspect that might be what's causing their itchy bottom?
The truth is, Freya, most of us don't check. Most of us, if we suspect it's worms and there's not another cause for the child's itchy bottom, so eczema or, significant sweat, we would just treat the child and the family because actually finding the worms is actually quite hard. So if you do want to do it, which you're welcome to try, I personally haven't tried it, but you want to do it at night, you need to get a torch, and in the middle of the night you need to try and open your child's buttocks and you might see some tiny white threads moving around. It's pretty gross. The other recommendation, if you really want to catch them, is to put some sticky tape around your child's bottom, around their anus, and when the worms crawl out, they stick onto the sticky tape. So if you want to do that, you're welcome to, but most of us, if our child has an itchy bottom, the treatment is pretty palatable, it's pretty easy for the child to have, and it's safe, so we often just treat.
And how worms spread then if one child has it? Does everyone have it or...?
Yeah, so worms live in the lower intestine, and as I mentioned, they come out of the bottom, out of the anus at night, and the eggs get stuck between the child's bottom. And it's estimated that one female threadworm can lay up to 16,000 eggs.
Oh, God.
The threadworms are spread when the child scratches their bum and the eggs collect under their fingernails. And then they often lick their fingers and they ingest the eggs, and this horrible cycle starts where the child swallows the eggs hatch in the child's intestine, and the worms travel down and out their bottom, and the cycle starts. And the eggs can actually survive outside the body for about 2 weeks. And the eggs can spread indirectly into food and dust and other items. So it's really important, if there's lots of worms in your families, and we'll talk about one of the treatments, is to keep those fingernails short and try and prevent your child from scratching their bottom in the middle of the night. One of the important things I think to remember is you can't catch these type of worms, these threadworms, from animals. So if you hear there's been a worm problem in your animal, it's a different worm than we see in the children.
And so, Lexi, how do we actually go about getting rid of them then? What are some of these treatment options? I'm delighted to hear that they're palatable and that they're safe. So how do we do it?
Most of the treatment options are over the counter. Go to the pharmacy, tell them you're worried your child's got worms, and they'll give you often a chocolate flavoured little medication that your child and the rest of the family can take. And they contain medications, something called Parenthral, mebendazole. They're the common ones we use in Australia. The only recommendation in younger children under 2 and pregnant women, it's not recommended to have the worm treatments, but otherwise over the counter, often chocolate flavoured. Delicious.
And do you need to treat the whole family or just the child that's got the worms?
I always recommend treating the whole family unless there's a reason such as a pregnant woman not to, because otherwise we get into this cycle of reinfection. So to try and stop that reinfection, even if someone doesn't have symptoms, just treat the whole family.
And is repeat treatment necessary, or is it a one-shot done?
So repeated infection is really common. So there are some precautions and preventions that can be helpful. I would say if your child does have itchy bottoms still after a week or so, you can definitely retreat them, but you want to think about those other measures to try and prevent them getting the worms.
And so is there anything you need to do around the home if they've got worms? Like, do you just leave their bedding, or do you have to strip the bedding and wash the bedding and things that they're sitting on?
Yeah, so if your child has recurrent worms, then I recommend a few things. One is to intensively treat the whole family, and often that's, weekly for a few weeks if it's recurrent and been an ongoing issue. And that's when I would say do that intensive washing of all the clothing and the bedding for everyone, and get around and cut everyone in the family's fingernails really short. So that's if there's recurrent worms. If the individual child keeps getting reinfected but the other family members are okay, then it may be the treatment's not working. It might be that it's not your conventional worms, it might be something else. So that's when it's a good idea to go and see your GP and get checked. They may do a poo test, they may do some blood tests. Particularly if you've been travelling, it may be a different type of worm and may need a different medication. And some worms actually become resistant to individual medication, so you might often have to switch medication as well. The other important thing is if your child's unwell, so as I mentioned, worms, your child's usually irritable, not sleeping well, maybe have an itchy bum, but they're not unwell. So if they're unwell, if they've got tummy pain, nausea, vomiting, fever, it's not conventional, straightforward worms. You need to go and get checked out.
So Lexi, beyond, you mentioned earlier, making sure that nails are cut short, those sorts of things, is there anything that we can do to help stop our little ones from catching worms? Are there particular types of play or areas, perhaps, sandpits or things like that? Are there areas where they pick the worms up from, or how can we stop it entering the home in the first place?
That's a good question. I think the most important thing is trying to prevent your child from reinfecting themselves. So as I mentioned, keeping those fingernails short, trying to stop them scratching their bums, easier said than done. So I would often say at night, one of the tricks is putting their underpants on top of their pyjamas, making it harder for them to get in there and scratch at night. Trying to get them to stop biting their nails or sucking their thumb is really helpful. Getting them to wash their hands really thoroughly and also under their nails is good. As we mentioned earlier, washing that bed linen, the towels, the toys in hot water, vacuuming the floors in your own home regularly. I know they do that at childcare, so that's really helpful. Cleaning those surfaces, all the things we've learnt during COVID are really good, infection prevention measures. So the same goes with worms. But, we want kids to play. We want them to be part of the environment. I don't want to, lock my child out of the sandpit if everyone else is playing in them. So I think really just the more simple measures you can do are what I would recommend.
And is the treatment immediate, or does it take some time to become effective?
So it often will take a few days for them to stop that itching and scratching. And that's why we often recommend treating again in a week and for a few weeks if it's been there for a little while. But often there's also redness around their bottom, and that causes them to itch and scratch. So because we're not catching the worms, you often won't know whether it's just the skin that's irritated or whether they're still worms.
Lexi, thank you so much for sharing your information and expertise with us today.
Absolute pleasure.
A huge thanks to Mistela for sponsoring this episode. The one thing you are going to be doing a lot of when you have children is bathing them, so it is important to choose products that are natural and dermatologist and paediatrician tested. For everyday bathing needs for normal skin, try Mistela's Gentle Cleansing Gel and Hydra Baby Body Lotion. Mistela is our family's favourite.
You've been listening to the Expert Guide to Parenthood podcast. Never forget, parents, you've got this.
Join a Parents You've Got This masterclass today to be prepared, excited and educated for pregnancy, birth, baby and parenthood. Visit www.parentsyou'vegotthis.com.au and sign up for a masterclass today.
The information provided in this podcast is general in nature and is intended to support, not replace, a discussion with your doctor or healthcare professional. Parents You've Got This take no responsibility for any medical decisions made by individuals based on the information provided in this podcast.